Morning. I'm Dr. Bowden. I am a registered dietitian and the director of research at Summit, and I am with...
I'm Dr. Snigdha Ancha. I'm an interventional pain management specialist at Holy Cross Hospital, Mountain Point, and I am very excited to have this conversation with Dr. Bowden. Today at Rounds, we had a conversation about the importance of nutrition perioperatively, and the discussion centered around what are the practices that are happening right now and how that can affect the patient's outcomes, both in a positive and a negative way, and how we can impact that with some of the work that Dr. Bowden is doing. And I thought it was a great discussion, so we would like to shed a little bit more light on that in this round.
So I think one thing that you brought up and that the group brought up was that we have a history of habits as far as nutrition and preoperative fasting and things like that that are still lessons to be worked through. And that's one thing that I'm hopeful that as we discuss more that we can focus our efforts on helping patients get optimal nutrition but still be safe, because as you're very aware, we want to make sure that aspiration is not an issue.
Yes, as an anesthesiologist, I have never thought of that element. For me, my entire training focused on how to make sure that the patient does not aspirate before you sedate them. But I never even thought about, okay, if the patient is missing out on these nutritional components streaming in their bloodstream during the surgery, because as you mentioned, it's almost like running a marathon. That is the way the body is subjected to the stress of surgery. And we don't have any nutrients circulating through our bloodstream that have been given externally. So I like the protocol that you are working on currently, which is adding simple amino acids, some carbohydrate load, and some micronutrients, just so they're circulating in the bloodstream as your body is undergoing through this marathon kind of scenario. Tell us a little bit about that.
So I think it's really important to make sure, first of all, that the patients are safe, which is why we've been very careful in looking through the literature and seeing what micronutrients and what macronutrients are going to be safe to be able to be put together and to clear the stomach so that we have patients in a safe place. But at the same time that they're getting those nutrients so that they have the energy to go through this surgical process, and that their bodies aren't just drawing from their muscle stores to be able to heal and to cope with that stress situation that their body is going through. Even with a minimally invasive or an arthroscopic surgery, there's stress and trauma that happen to the body. So we've been focusing on getting in some good carbohydrates in a simple source, although we're combining some different carbohydrate forms, which helps with that gastric emptying. And then getting those amino acids in, because those are really important in that healing process. And when they're in that simple amino acid form, they don't require digestion. So they are going to clear quickly, and we can have the patients, first of all, feel better because they're happy, because nobody likes to go without food for a long period of time, especially when they're stressed, and then be able to have those nutrients there to recover more quickly from that surgery.
And it was interesting. I would have never thought that having an additional volume in your stomach, if it's formulated the right way, it will actually help with gastric emptying. Can you tell us a little bit about that?
Yes, there's a little bit of research out there, but we're also finding with our study that for people who may have a little bit higher residuals in their stomach naturally, that maybe kind of on that edge of, even though they've fasted for 12 or 16 hours, their volume is still a little bit higher, that if they're having something with this mixture of nutrients in it 2 hours before surgery, their stomach volume is going to be smaller by that 2-hour point than it started with, which means there's less likelihood of a little bit of a risk of aspiration just from those stomach secretions.
Yes, and stomach volume, as we know, is directly related to the risk of aspiration. And you're using an ultrasound. Could you tell us a little bit about how you are, what times you are measuring the gastric volume, and what have you seen?
Yeah, so we're looking at gastric volume just when a person's fasting, then we're giving them a dose of this supplement, and then following up at 30 minutes, 60 minutes, and then every 15 minutes after that to see when they've reached a point of an empty stomach. And obviously we're missing some faster time points where they might have been empty, but this gives us a pretty good picture of when people's stomachs are emptying, and we're seeing kind of a natural trend that by 30 minutes, you know, they've got a fairly full volume, and then some people are empty by an hour after, and everyone we've looked at has been cleared by about 2 hours, and those are the outliers. The majority is somewhere between 60 and 75 minutes, which is nice to know because we're wanting to make sure that there's an adequate window, that saying, you know, give this 2 to 3 hours before surgery is more than ample, but still gives them those nutrients that they are needing to be able to go into that surgery feeling a little bit better.
Yeah, I love the concept of adding a little carbohydrate and amino acids, because amino acids, as we know, are building blocks. Carbohydrates are going to give you the energy for the body to keep all its cells functioning so that we're not breaking down muscle and grabbing glucose from the muscles. Tell us a little bit about the micronutrients that you have formulated into this mixture.
So we're using a literature-based group of nutrients that are going to be supportive of surgery recovery. We're adding some extra vitamin C, which potentially can also help with pain. Actually, people tend to use less narcotic if their vitamin C levels are higher, which is helpful because then we're making it so that people aren't going through as much narcotic afterwards. And so we're hoping that that will be helpful as well, giving those few micronutrients that can have a positive impact.
Yes, I myself, being a chronic pain provider, I'm familiar with the concept of having additional or high-dose vitamin C around surgeries to reduce the risk of certain conditions like complex regional pain syndrome or chronic neuropathic pain. So that's good to know. I thought it was such a great piece that we don't think about. How can my patients or any patients who are undergoing surgery get enrolled into your particular study?
So anyone who wants to participate in the study is welcome. They just need to give Summit's office a call and they'll get them in contact with me, and we can definitely have them participate.